Hello everyone. This is Dr. Duggan, primary care doc, trained in both family medicine and adolescent medicine. So today I wanted to kind of continue our talk about Pap smear screenings and actually show some of the equipment that's used and also the process of what it is essentially. So first off, whether it's your doctor, your healthcare professional, you want to ensure a chaperone is present as well, and also that you have consented to have this examination done. So that's most important, that you feel safe and that you feel comfortable during this exam, which really invades our private space and our private parts, okay? So in terms of equipment, or supplies, I should say, we definitely have our gloves. Then there's also our speculum that we use that shows us where we need to go. Our brush, some people also use a broom. Our pap, our liquid solution that we actually place the specimen in once it's collected. And a pad that can be used just in case there's any bleed or any spotting, after the fact. So I tried to think of the best way to demonstrate this. And I didn't want to waste a donut, so I decided I'll just kind of use my hand to show us what this looks like. So essentially what we're looking for is what's known as the cervical os, the cervix and the cervical os. And that's going to look like a little donut that's there. And what our speculum does, it gives us kind of entryway, a pathway, so we can see, there we go, our donut more clearly. So once your provider sees the donut, then we use our brush or our broom to collect the samples from the surface of the cervix. So again, this is where baby comes out. We're turning about 5 to 10 times or so, and then I'm handing this off to my nurse that's present with me. The speculum, which again is still there, but now we're gonna remove it as gently as we can because we wanna make it as comfortable for you as we can. And then again, my nurse will place the specimen that we obtained into our solution, and that is what gets sent to the lab. Usually our results are back in about a week. So once this is completed, or rather during the exam, if you're uncomfortable at any point, do let your provider know. There are different speculum sizes, so we can always switch and adjust depending on what we need, if we're not able to see, or if it's uncomfortable to you. Typically, it is not painful to have your pap smear done, but there may be some pressure, there may be some discomfort with use of the speculum until it's removed. After this is completed, we also like to do what's called a bimanual exam. And this time I'm actually taking a feel with my hands to see how does the uterus feel. Is it more of a smooth surface? Is it positioned as expected? Making sure to feel in the adnexal or ovarian areas to make sure that they feel okay, or that I'm not feeling any masses or anything as well. So essentially that covers the pap smear examination. Lastly, here are a few tips of some things that you should probably avoid at least a day or two before getting your pap smear done. So number 1, sex. Number 2, douching. Number 3, any type of vaginal like suppositories or medicines. Let's try to avoid those if at all possible. So in that way, we want to make sure that we get a good specimen. Also, if you're bleeding, if your period started, it's okay. We can always reschedule your pap smear for another time when your period isn't actively going, isn't flowing. That's perfectly fine. Sometimes we may use lubricant, but if possible, we should use like lukewarm water on our speculum prior to insertion. Again, more so making it comfortable for you as our patient. So I hope this information has been helpful for you. Here in Health, Dr. Duggan. Bye.